This is BBC News at 10 o'clock. I'm Jane Hill in Westminster. In the next couple of hours, we will hear the findings of the public inquiry into catastrophic failings at Stafford Hospital, one of the biggest scandals in the history of the NHS. More than 400 patients died unnecessarily at the hospital, neglected and uncared for.
They can't seem to understand that the way my husband died, that I'll always have that feeling that I've got that life sentence because he shouldn't have died there.
Hello and good morning. Welcome to Westminster, where here in the Queen Elizabeth Conference Centre behind me, people are now reading that report by Robert Francis QC. It is not the first report, of course, into failings at Stafford Hospital over so many years, between 2005 and 2009. But today's report is to try to establish why the supervisory bodies effectively didn't do their work. What went so badly wrong that so many patients suffered needlessly, that some died unnecessarily over those years? His report today is analysing the breakdown in the system that was meant to supervise, that was meant to pick up on the problems at the hospital. We will be discussing the many implications of Robert Francis' likely findings over the next couple of hours. Let's get this report, first of all, from our health correspondent, Dominic Hughes.
This one here, that was in Turkey as well. That's one of his good days where he was smiling.
A catalogue of failures and poor care at Stafford Hospital led to the death of Christine Dalziel's husband George in 2007. She soon found she wasn't alone, one of hundreds of families who lost loved ones in what should have been a place of safety.
They've left us with a life sentence. You know, they can't seem to understand that the way my husband died, that I'll always have that feeling that I've got that life sentence because he shouldn't have died there. But they will not seem to accept it.
Can I borrow your arm to do
Staff here at Stafford Hospital and across the NHS say dignified, high-quality care for patients has become a priority. So this public inquiry into why the terrible events at Stafford were allowed to happen promises to be a significant moment.
No one can hear the stories of patients and families who were affected by the events there and not be moved. So I think it will have a very significant impact both on professionals at the front line who are there every day trying to deliver a high quality service and who find it challenging at times.
This report is likely to reverberate across the health service in England. It will focus on the role of the regulators and the other bodies that should have stopped the catastrophe that unfolded here at Stafford Hospital 5 years ago. The real test, though, will be whether it can prevent another disaster unfolding. Dominic Hughes, BBC News, Stafford Hospital.
Well, first of all, let's head to Stafford Hospital itself. As we got the suggestion there, so many local people played such a key part in throwing light on what was going on there. Let's get more from Phil Mackey, who's there for us all day. Phil.
Yes, Jane, and when you heard in Dominic's package there about the hope that the Francis report will effectively change the culture within the NHS, then certainly here at Stafford they've put the house in order in the intervening time. We're talking about a period between 2005 and 2009 and there is now a very active support group to try to save the hospital. Because of what's happened here, they've been struggling to stay financially viable. They've had to close A&E, for instance, overnight. Initially as a short-term measure, but it's been shut for 15 months now. I've got Cheryl Porter here from the Save Stafford Hospital group, and Cheryl, your son's actually being in there treated for a broken finger at the moment. You got, I don't know how many thousands of signatures to try to help the hospital.
It was a shared get-together of the signatures. We got over 20,000 in all.
And you went to number 10 to hand that
yes,
petition
we
in.
delivered them in.
And what are your concerns about the future of this hospital? Because it is very important still for the community to have your district general hospital.
Oh gosh, yes, it's so important. The people of Stafford deserve a safe hospital, a local hospital. They deserve their local services. And there's a new management team. They are putting everything together to, they've put it right. The A&E, the criteria that they set there was above the rest of the country. and we're still waiting to find out whether that will reopen overnight. For us as a community, it is so important that you have your local services. You know, my son's in the hospital now with the finger specialist, you know, hand specialist, so to us, we can't be travelling miles for these things. We know specialised things have to happen in specialised hospitals, but you have to have your local services for your local community.
And your fear is that because of the taint that is associated with Stafford, it's been hard to recruit in the past, and it's running at a loss at the moment, that ultimately it might get downgraded.
Yes, there is that. It is operationally sustainable. Financially, no. But this is where we need to get people to start asking to come back to Stafford, to know that it is safe now and they should be coming back, and the GP should be telling them that their own local hospital is safe to go and have procedures in. There's lots going on here now that are marvellous, and we know what's happened in the past, but we have to move, you know, forward and look to the future of having a hospital in the Stafford area, a local hospital.
Okay, Gerald, thanks very much for coming out in the cold this morning, and you've got to go and look after your son in a minute. Interestingly, I walked into the canteen to get a cup of coffee, and yes, medical staff are inside there going about their daily business, looking after patients, with us standing outside effectively telling a story of horrific events that went on here in the past. But what Stafford Hospital, I'm sure, will say later on when they react to what Robert Francis has to say, is that they've put their house in order already. It's for the rest of the NHS, Jane, to put theirs in order as well.
Interesting, yes. Perhaps we will talk more about the rest of the NHS over the course of the day as well. Thanks for now, Phil Mackey at the hospital itself. Let's talk now to Dr. Paul Hodgkin, because he's the CEO of Patient Opinion, which is the NHS feedback site. Morning to you.
Good morning.
Of course, what we're all focusing on today is that we don't want things to go wrong in the first place, but there are still examples of poor patient care. What your organisation, your setup does may feed into what some of Robert Francis' recommendations later on today.
Absolutely. I think that the most important thing for you and me and for viewers is to understand what we can do about this, because unlike 2006, there's many ways in which your voice about what's happening with your mum or your care can be heard. Patient Opinion is an independent site where we aim to get your story to just the right people in Middlesbrough or in Bristol who are responsible for that service. So your voice can really make a difference.
To what extent is it about whistleblowing, or is it purely about, I suppose you would say you welcome good comments as well as negative comments, but one of the key things we keep hearing here is that there were good people working at Stafford. They knew things were not right, but they were at best they were ignored, or at worst they were too frightened to speak out.
Well, I think that's certainly true, and I think staff also use Patient Opinion to voice their concerns because it's anonymous and independent. So I think what is happening here is that because everybody has got a voice now through Twitter, through Patient Opinion, through blogs, it's much easier to get your viewpoint across, and using the right platform, you can get it to just the right people. So I think whether you're staff or carers or the patient or service users, let's all get out there and actually use these new mechanisms, which weren't really running back in 2006, 2007. We were only just starting then. And I think there's a real opportunity to make a difference, because a lot of what the NHS does is great, but it's kind of more of the same. Lessons will be learnt, and people are saying that stuff and they mean it, but actually it feels a bit like nothing's changed. And this is something that we can do. We can do to say, let's make our NHS better. Let's take a bit of control over those parts of care which we really know about, whether we were treated right, whether people were rude to us or not, and say when it was and say when it wasn't.
I mean, I suppose a family member who's going through a terrible time anyway, by definition, their loved one is in hospital, they're not well, if they feel something's not right, they would want to know, A, the right place, the best place to go, but also if they are going to take a precious half an hour to sit down and write an email or make a phone call, they need to know that that is acted upon. And there will still be people listening to all these horror stories again today who think, you see, nothing changes, what's the point in me taking the time to complain?
Sure. So it's great when people take that time to do that and to tell their stories, and it is, you're absolutely right, important that they're heard. And on patient opinion, you can see who's read your stories, which organisations have read your particular story. If you just click on the story, you'll see that. So you can see what's happening, and about 60% of stories get a response, about 10 or 15% get a certain, actually an improvement is made. We obviously can't guarantee that, and half the people are saying thank you anyway, but it's really effective way a lot of the time to actually make a difference, to make sure that what your experience of the NHS goes through and makes a difference to that particular ward, to that particular clinic, and is heard, because you can see it happening.
Well, we will see to what extent that figures in the recommendations today. Thank you very much. For now, Dr. Paul Hodgkin from Patient Opinion. As we say, Robert Francis QC, who's conducted this inquiry, people are reading his report right now. He will speak publicly just after 11:30 this morning, so we'll have full coverage of that. We'll hear his findings and, crucially, his recommendations, as we've just been reflecting. So that's coming up from 11:30. Also to remind you that we keenly await the government response as well, and the Prime Minister David Cameron will be giving the government response in the Commons immediately after Prime Minister's questions, so at 12:30 today. So much more to come, and more from Stafford itself as well, of course. For now, from here at Westminster, back to you.
Jane, thank you very much.